of stress on our lives. So, to set the ball rolling, I would like to define stress. So, by definition, stress is a normal response to any situation that pressurizes us. This could be a mental response, a physical response, an emotional, or even a behavioral reaction to anything that is demanding on us, anything that threatens us. This actually could be perceived or could be real. So anything that is perceived to be pressurizing, demanding, threatening to us is stress. Like I mentioned earlier, stress is a normal part of our lives. We all experience stress. But we can actually talk about different types of stress, talk about the fact that stress is necessary for our survival. Stress is actually good. We are able to survive because of stress, and I hope to explain this more into detail as I go along. But we find that it is that reaction, the stressful situations, that sometimes energizes us, that sometimes gets us to maximize our potential. If there was no stress in life, nobody would have any push to even pursue um academia, go on in life, be in our careers. If there was no push in our lives, we would not even show up for this discussion this evening. So stress is necessary for our survival. It's actually good for us. But then we also know that sometimes stress can negatively affect us and can impact on our health and well-being. And that is where it is a problem. And that is when we need to do something about it. Basically, we can talk about stress that is short lived. It comes usually suddenly in a short time and goes away. But there's also the kind of stress that some people experience, which is long standing over a very long period. And this is particularly the kind of stress that often negatively impacts on our health. As humans, we cannot stop stress completely, but what is most important is for us to be able to cope with it, adjust and adapt well to any kind of stressful situation. So I like to explain exactly the reaction that goes on in our body anytime we are under stress. And this reaction or response is what we call the fight and flight response. And I always like to use an analogy of facing a lion in the forest, in the wilderness somewhere, because that analogy actually helps explain exactly the response that goes on in our body. So imagine yourself somewhere alone and you find yourself in a situation where you meet a hungry lion. Ask yourself, what will you do? For most of us, I'm sure the answer will be to flee, to run away for our own survival. You would have some others. If you are as strong as Samson, you may want to fight with the lion. That is actually the kind of response and reaction that our body goes through anytime we are faced with stress. Now, what does this fight and flight response mean? What it means is that your body is prepared for warfare, and so it needs to gather enough resources and send to those organs that will need the resources for warfare. So you can think about a fight or flight situation with the lion. Most likely you would need your muscles, your skeletal muscles, to do a lot more of the fighting. So you need more resources sent to your muscles to do the fighting or the running away. And you can think about what's most likely will happen.
Hello, Doc.
Hello?
Yeah, there's some windy noise in your mic. I don't know where you are, if it's in an open space. There's some windy noise at in the background.
Please, is this better?
Now, yes.
Okay. And so, like I was saying, you need resources sent to your skeletal muscle for the fight and flight response. So what happens to your body is that you get your heart beating faster and stronger to be able to push more blood and oxygen where it needs it the most. You get the chemicals or the hormones in your body gathering and bringing in sugar or glucose from all kinds of sources into the blood for this fight and flight response. While all this is going on, it's important to note that because the body is mobilizing resources to where it perceives the resources are needed, other organs will be shut down, if I should put it, because resources will be shunted from these organs. So of course, it is not during the fight and flight response that you will be having an ejaculation, for example, or you'll be digesting your food or be urinating, because of mobilization of resources to where the body needs. And so you can imagine you have several organs suffering as a result of this fight and flight response, especially when you have this warfare mode of fight and flight response going on for a very long time. So I know this picture may be scary for some people, but I just brought it here because apart from the changes that I described that happens in the body, the mind is also affected when you are going through the stress response or when you are under stress. And this picture is just a picture of the brain. I want us all to focus on the part that is painted red. This is the front part of your brain. And this is the part of the brain that is severely affected when you are under stress. Studies have shown that this part of the brain shrinks. But you know what? It is this part of the brain that is supposed to help you with your creative and logical thinking. If you need the ability to be able to plan and strategize, to be able to concentrate, or to be able to pay attention to things, it is this part of the brain that is helping you. It helps you with your working memory. and also to control your emotions. And studies have shown that when you are under chronic stress, you lose connections in the brain cells in these areas. And that is what we see as the shrinkage in this part of the brain. So you can understand why sometimes some people with undergoing a lot of stress become so forgetful. They tend to have their emotions all over the place, very irritable. Basically, your creative thinking functioning goes down. So the impact of stress is not only on our physical bodies, having some organs working more and others shutting down, but also a big impact on a very important part of our brains. So I'm showing this picture, which is a picture of a brain cell, just to show you that brain cells have some connections. They have some tentacles around them, which helps the brain cell to work well. And this is what I was explaining earlier. When you are so much under stress, you lose these connections, which affects the functioning of the brain. So when it comes to the sources of stress, there are so many of them. And oftentimes, it's multiple of these sources of stress combined, affecting us all at the same time. It could be stress. So I decided to, this list is not exhaustive, but I decided to group them under those sources from our personal lives. At the workplace, as adults, we spend a majority of our daytime hours working. And for many of us, we are going through a lot of stress that is associated with our work. Sometimes it has to do even with our social and economic environment. So it's a very complex mix of all of these stresses that often affect us at any point in time. So with my explanation earlier, I'm sure when it comes to the signs and symptoms of stress, we can all relate to the reason why for some people, when they are so much under stress, they have difficulty concentrating, they get angry, they get moody and frustrated. I want us to focus on the physical signs of stress. And these signs are real. A lot of the time, people present to the healthcare facility with complaints, headaches, complaints of feeling sick. And to them, most of the time, they believe it is malaria, typhoid, or some kind of sickness. And it will interest you to note that for a lot of these people with these symptoms, they are not faking the symptoms. The symptoms are actually real. You are actually experiencing these symptoms. But you have stress contributing or causing some of these symptoms. And I find it very interesting because many of us do not know that the prevalence of malaria and typhoid is actually very low these days. But for a lot of us, when we are having symptoms that suggest to us as malaria, we do all the tests. Could be a rapid test or a blood film. We never get satisfied. The tests come out as negative and we don't believe the test. We still go ahead and take anti-malarials. Most of the time, you truly do not have malaria, even though you seem to have the symptoms. And again, we are very happy to treat typhoid, even without the evidence to suggest that there is typhoid. And we like to even treat typhoid infection as a very chronic and long-standing infection. Many of these symptoms are due to stress that has not been recognized and managed. And stress, is also important to understand the social consequences of stress. When you're under stress, it impacts on your quality time that you need to spend with people you care about. So oftentimes relationships also suffer. So the impact of stress on physical health, as I explained earlier, about 80% of major illnesses have stress as a contributing factor. So you can understand how being in a stressful situation could actually lead to weakening of your immune system, which makes you more susceptible to all kinds of diseases and conditions. I quite remember when I was in secondary school, I used to ask myself why so many of us went to the sick bays and the infirmaries when it was close to exams. It was much later that I understood this. When you're under stress, your immune system goes down. You have a higher risk of catching upper respiratory infections and other infections. And with a weakened immune system, you have a higher likelihood of having cancers, ulcers, duodenal ulcers, and the likes. Heart disease, your heart is pumping more faster. If you have the predisposition to having hypertension and other cardiac conditions, when you're under chronic stress, that can be a predisposition, or that can be the factor that can lead you to having the heart disease. Same for diabetes, because your blood glucose levels also go down. In fact, when we talk about stress, stress affects the human being from our head to our toe. No organ is spared. It shows on your skin, it shows on your hair. You tend to have more hair thinning and more hair loss, amongst others. And research has shown that chronic stress actually doubles an individual's risk of having a heart attack compared to the general population. So this is a picture basically telling us that when we are under chronic stress, it basically affects almost all of our organs, including our brains, which I have already mentioned. And so I don't want to just keep painting that gloomy picture. It's important that we also discuss some of the strategies we can use to mitigate the impact of stress on us. We cannot do away with stress, as we have all learned. It's a normal part of our lives. But we need to take active steps to reduce the impacts of chronic stress on our health. So with the strategies, all the strategies I will be talking about are strategies that are simple, strategies that many of us know and are aware of, and strategies that can be employed easily, that can improve our mental health and reduce our stress levels. So the first is speaking to someone you can trust. This is so important. It has to be someone you can trust because of course when you are overwhelmed and you are pouring out onto another person, you do not want somebody who will send your information outside to Peace FM, for example. So someone you can trust. It's always important to speak out when you are overwhelmed. Talk to somebody about what you are going through. Sometimes the person on the receiving end, the person listening to you, is not in the position to directly solve that problem you find yourself in. But the fact that the person is there for you and is listening to you, that action on its own reduces the burden that you have on you. Also, sometimes when we find ourselves in overwhelming situations, it appears that we have lost options. And that can be a trick the brain can give to you. But it's important to also reflect, have some time to reflect back. Most likely, you have gone through one stress or another in the past, and you have used certain strategies that have helped you. So it's important sometimes to just sit back, reflect on some of the things that has helped you in the past, and just go back for those strategies. We don't change the winning team. Also, try and engage in hobbies. It could be a new hobby you have found or going back to an old hobby. Find something that you enjoy and do it. And find some time for yourself. Having time for yourself, doing something you enjoy, is not being selfish and is not a luxury. In fact, it's a responsibility. When it comes to this slide, I'm sure all of us know that eating well, exercising, if not for our mental health, we know that it is good for our physical health. But sometimes there's a big difference between knowing and doing. And so I want to emphasize this again. Eating well. For some people, when they are under stress, it is easier to get a quick fix. You grab a bottle of soft drink, or when they're under stress, is when they may go in for a fast food or junk food or something. But studies have shown that you can actually eat your stress away. You can eat well and eat your stress away. And it's the same old healthy dietary options we talk about all the time. Fruits, vegetables, legumes, whole grains. Fish is excellent. Fish oils, which is rich in omega-3 fatty acids. So omega-3 fatty acids are excellent building blocks for the brain. And so when you are under stress, make that conscious effort to eat well. Exercise cannot be overemphasized. Having some physical activity in your routine improves your mental health. In fact, with physical activity, you tend to have more growth factors for the brain cells, which helps build that connection I talked about earlier, the ones that we lose when we're under chronic stress. So have some time to exercise. Start from somewhere if you don't have any physical activity at all in your routine. Someone may ask, if, for example, you have a deadline to meet and you have the option of exercising, which one will you do first? Most people may think of meeting that deadline, and may think that, oh, when I go and exercise, I will get tired. But studies have shown that with exercise, your brain becomes even more efficient with the work you have to do. If you had to spend 5 hours on work after exercise, you spend less. Same with sleep. Sleep is so important. During the daytime, we are bombarded with so much information. It is during the time that we sleep that our brain takes its time to consolidate our memory, to prune and remove all the unnecessary excess information in our brains, also to make our brains more efficient and ready for the day. So it's important to have regular sleep. And I know for a lot of adults, most people are not having enough sleep. But we need to also make that conscious effort. At least, if you can have 6 to 8 hours of sleep 3 times a week, that will be good. If you can do more than that, then that is excellent for your brains. Sleep cannot be overemphasized. And there is one thing that tends to affect our sleep a lot that I think I should mention: the devices that we use, the blue lights on our devices. It does affect our sleep levels, and so we need to try getting close to bedtime to put our devices away. And then also we need to be realistic with our expectations. Of course, if you set very high expectations for yourself, that is a lot of stress for you. And so we need to be very realistic with expectations to reduce our stress levels. And then showing gratitude. Our minds often likes to play back all the negative things, the wrong things that are going on in our lives back to us, all the negativity. But sometimes we also need to actively redirect our minds to think about all the good things that has happened to us in the course of the day, in the course of the week, in the course of the year. And it can be very difficult keeping track of all the wonderful things you can be grateful for. So you can actually journal, write it down as and when the good things happen, and remind yourself from time to time. You can go back to your writing on weekly basis. You can do it monthly, quarterly, mid-year, yearly, and see all the wonderful things you can be grateful for. You will find that no matter what stressful situation you find yourself in, there is so much to be grateful for. Sometimes we need to be firm, assertive, and politely say no. Saying no to certain tasks or activities that add on to our day-to-day stress. And sometimes it is not a good idea to try to please everyone. So we have what we call the circles of control. The circles of control, basically, there are 2 circles. The inner circle talks about the things you can control as an individual, and the outer are the things that are outside of your control. So in whichever situation you find yourself, think about the situation. Is this situation within my control or not? If it's outside of your control, let go of that thing. No need worrying and stressing about those things. An example is another person's behavior or action. You have no control over that. So there's no point stressing over that. Or even the dollar rate currently. It's outside of your control. What you can control is, for example, finding something enjoyable you can do, having a more positive attitude towards things. Those are within your control, and those are the things you need to focus on. Sometimes we just want the quick fix. And for some of us who have problems with sleeping when we are under stress and all kinds of symptoms, back pain, and all of the headaches, we like to take over the counter medications to help with our symptoms. These days, energy drinks are very common, caffeinated and energy drinks. All these may seem to be helpful in the short term, but in the long term, they tend to have very bad consequences. So minimize your use of over-the-counter medication, caffeine, nicotine, energy drinks, alcohol, and other substances. Supporting one another is so important. What can you do for others? Sometimes it can be hard to know where to begin or what kind of helpful advice to give to somebody who is overwhelmed. Like I mentioned earlier, sometimes you don't even need to say much. All you need is to be there for that person who is overwhelmed, to listen to that person and be there for that person. That can just be enough for supporting somebody who is overwhelmed. Relaxation exercises can also help. There are many of them. We have the deep breathing exercise, which uses breathing through your diaphragm to calm your nerves. So you do a lot more of breathing through your abdomen than your chest. You take deep breaths through your nostrils and you so you can do this a number of times, and that has been found to be useful in calming people down, nerves. Also, we have what we call imagery, where you can imagine something that is relaxing and peaceful for you. You do deep breathing exercises alongside, and you try to engage all your senses in the imagination. That can also bring relaxation. We also have the progressive muscle relaxation, which looks at contracting and relaxing your muscles from your head to your toe. After you are done, it releases the tension. So all these relaxation techniques I'm talking about, you can actually find online on YouTube. You have a therapist with a soothing voice taking you through some of these, so you can actually check them out as well. It's important we take rest, we take our leaves annually, and really use our leaves to rest. Regular medical checkups are also important. It's extremely important that we get help. As a human being, when you are overwhelmed, it's difficult for you to cope and manage. Please get help. Sometimes stigma prevents people from seeking help or asking for help, but asking for help is actually a sign of strength. And depending on what situation you find yourself in, you can get help from people that are close to you who can help you. Sometimes it's work related stress, so you may have to go back to your supervisors and have some discussions with them. Sometimes it's with family, it's with friends, it's with a spiritual leader or a counselor, religious leader, or with your healthcare provider. Could be a clinical psychologist, a psychiatrist, a mental health professional. But the key word here is that help is available. Usually, we would want you to seek professional help from a mental health professional when it's become difficult for you to cope and it's affecting your functioning, your ability to play your role well. Or when, for example, you find that you are contemplating harming yourself or even harming others, you are feeling very disoriented and feeling very anxious and fearful. Your symptoms are very severe and it has been persistent than what is expected. We would advise you to seek professional help. So thank you very much.
Thank you very much, Dr. Ajua Kusichire. Thank you very much for such a well laid out presentation that detailed everything that we need to know about stress and its management. Like you rightly said, some of the things may look like cliches, but when we do them, the results are very clear. It's time for questions and answers. If you have any question, any clarifications that you might need, please feel free, put in the chat box in the comment section, and Dr. Kusichire will gladly answer you. Thank you very much. Put in the chat box in the comment section, and you will be attended to. Thank you very much. Everyone is allowed to ask questions. So please, we have 2 minutes for questions and answers. So feel free, put your questions in the chat box in the comment section, and you will be attended to. Thank you very much. Thank you very much. Thank you very much. Thank you very much. Okay, let me ask the first question. Doc, how many hours of sleep? I know you said it in passing, but I want you to just let us know again. How many hours of sleep would you advise the average adults on daily basis or routinely per day?
If you can, and if you have the luxury, it is recommended 6 to 8 hours of sleep. But for some people, because of adult life, work life, and all that, it's difficult to do that 7 days in a week. So what we say is that if you cannot at all, make sure that at least three days in a week you are having 6 to 8 hours of sleep.
All right, all right, all right. Now, my second question before somebody comes in again is, what if the source of stress is your immediate family? What do you advise?
So, having personal issues, family issues causing stresses is very common. In fact, I think everybody experiences that. What I would advise is that you take active steps. I've mentioned a lot of strategies that I think are quite simple that we can all do. You need to prioritize your well-being and engage in some of these strategies to reduce the impact of that stress on your life. It depends on what kind of stress you are going through, but if it's your immediate family, it's a kind of stress that is not within your circle of control, for example. So much worry, so much focus doesn't change exactly what is going on. So I would ask you to focus on yourself. What are some of the things that, for example, you enjoy, that calms you down, that makes you happy, that you can do? You need to have time for yourself, spend time with yourself to be able to do some of the strategies that I have mentioned. And even though in some of the situations you may not be able to take away the stress completely, it will improve your ability to cope with it and to adapt with it. So it will all depend on what kind of stress you are going through, but we need to focus on promoting our mental health with some of these strategies to help us cope with the stress or adapt to it.
All right. So my last question before a question is in the chat box. I would read out, but before that, what would you say is a comparison between our coping mechanisms in Africa as compared to people in the Western world when it comes to stress?
So, I think that our contexts are very different. We have our own way of coping in our country, for example, and in our context. And those in the Western world also have their own way of coping. I think that in our part of the world, sometimes we are not even aware. We are not even aware of the situation, the stress that we are going through, and even how we are manifesting it. We are not even able to understand our emotions well. So, like for example, I can be in a lot of stress. I am very irritable. I may be shouting a lot on my children and getting angered easily. I may not even understand that it is because of some form of stressful situation that I am going through. And I find that in our cultural context, we were not brought up to be able to even understand emotions, speak to it, even explain what is going on. But also in our cultural and in our context, we have our own ways of coping. So I find that there are a lot of social activities that goes on. So for example, in our cultural context, um when we take funerals, for example, we know that we are mourning, people are bereaved and all that, but it's also some kind of a social activity that helps people to socialize, to connect with other people. And I find that when it comes to some of these, so going for weddings, parties, birthday, celebrations, all kinds of celebrations, all these are important, and it helps to at least distract and to help us manage with some of the stress. I don't know if that answers your question.
Yeah, it
But the
does.
way we cope is absolutely different from those. Those outside may go on vacations. They have summer vacation. They travel outside of their countries a lot. So we don't do that, but we also have our own ways of coping, I think.
Thank you very
Thank
much.
you.
So there's a question. It says that what is the correlation between GCPD patients and then stress? Are they more susceptible?
Yes. So we know that people with G6PD um have some problems with specific enzymes which which causes them to break down their blood cells under certain stressful conditions. And so many things could actually bring on that stress to these individuals, including foods they eat, medications they are exposed to, and all of that. And so I would say yes, they would have that predisposition, because remember that even though I simplified the fight and flight response, there's a lot of things that goes on when it comes to um reactions, inflammations, and all of that, which is common in these individuals because of that risk deficiency and that risk that they tend to have. So I would say yes.
All right. Thank you very much. Is there any more question? Any more questions? Any more questions too before we can allow Dr. Kusitres to go on with her weekend activities? It's been very enlightening and been very straightforward, well laid out, detailed. So that's why we're not getting too many questions. Just playing the devil's advocate, how would you compare individuals who are raised from privileged homes versus individuals who are raised from disadvantaged positions in terms of coping with stress?
Good. So I didn't comment on that. When it comes to our abilities to cope and deal with stress, we are all different. And there are so many factors that come to play when it comes to the variability in coping with stress. A whole lot, which includes one's upbringing, exposures, past experiences, educational level. There are so many factors that will actually differentiate one person's ability to cope from another. And so before I continue with answering this question, it's important that nobody trivializes another person's stress. What might be very stressful for me that I will react to may not be stressful for you, and vice versa, because we all have different levels of coping and resilience. When it comes to coming from a privileged home, there's so many factors, and maybe I can give an example. So for example, if you were brought up from a wealthy family, maybe you didn't have certain kinds of exposures, you had um everything at your disposal. For example, you grew up, you became a nurse, and then the government posted you to a very, very remote village where you probably have to walk miles to get water and all of that. You may find that posting very stressful. It may be very difficult for you to adapt because you are not used to things like that. But you may also find another person who has actually been through that. Growing up, he or she is used to carrying out these chores. They are used to it. They actually know how to go about it. And so you may have two people. They are both nurses. They've both been posted to the same place. One person is coping very well. The other person is not. So it's really differs, and it depends on your experiences, your exposures, and all of that. So I don't know if that answers your question, but I cannot say that maybe coming from a privileged home makes you better at coping. It depends on what kind of because you can have somebody also coming from a privileged home but had a lot of experiences and exposures, have gone through some experiences and have built themselves up to be able to adapt to certain situations. So it will all depend on some of these factors. Thank you.
Welcome, welcome, welcome. I like the fact that you said no one should trivialize another person's stress. That is very key because we're all different. Very, very key. Somebody is asking, is there any specific strategy to manage stress in GCPD patient, which may be different from the ones you have given already?
Yes. Yes. So generally I'm sure you would have a tall list of medications and foods you need to avoid, which is extremely key. You need to have all these lists at the back of your mind. But also the strategies that I have mentioned. The strategies that I have mentioned will also apply to you. I must say that the strategies that I have mentioned, some may apply to you, others may not. So you can actually go through, you may know what would work for you and what will not work for you. So you go by those ones that will work for you. Thank you.
All right. Thank you very much, Dr. Adra Kusichire. If you have any final words, so that we appreciate your agreeing to honor this invitation again. We appreciate your availability. Please, if you have any final words on stress and its management before we can allow you to go. Thank you very much.
Yes. So what I want to say is that we are all human beings and we all go through stress. But if at any point in time you are overwhelmed with your stress, which will show in your inability to cope or adapt with whichever stressful situation, you see that it's beginning to affect your functioning, it's beginning to affect your life, your relationships, your work, and all that. See health seeking as a sign of strength and seek help because help is available. Thank you.
Thank you very much, Dr. Adra Kusichire. So that is Dr. Adra Kusichire, specialist psychiatrist and a medical educator of close to a decade's experience working with the mental health department of Ghana Health Service. She's laid out clearly what stress is, where it's likely going to come from, the sources, and how to cope healthily with stress. With very simple things that we can do on a day-to-day basis. Thank you very much, Dr. Adra. And a special thank you to you all for making time to join this episode of the Weekend Health Talk. Until I come your way once again, I'm Dr. Albert Sedon. Plum, it's been a plum pleasing pleasure serving you all. Enjoy your evening, afternoon, or morning based on when you get to watch this recorded version. Thank you all.
Thank you.